views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of Bronxnet or the program underwriters.
Good evening and welcome to BronxTalk. World AIDS Day is coming up this Saturday, December 1st. While incidence of HIV and AIDS is nowhere near what it was when the day was designated 30 years ago, it's also not disappeared. Advanced treatments have changed the disease from almost a sure death sentence to a difficult medical problem that requires attention, and if monitored and treated properly, people can live with it. In fact, the latest data shows that while fewer people are being newly diagnosed with HIV and AIDS in the Bronx, the percent of Bronx residents living with HIV has been steadily increasing over the last 15 years. Tonight, to bring us up to date and continue to educate and raise awareness, we'll talk to not only experts, but we'll also be joined by a patient who is HIV positive, and she will be able to give us a first-hand account. Please join me in welcoming back to the program a doctor who's been treating HIV and AIDS since the early 80s, even before it was defined as a disease. He knows all about it. He's a member of the American Academy of HIV Medicine and Associate Professor of Medicine at Yale. Welcome back, Dr. Richard Torres.
Thank you, Gary, very much.
Nice to have you with us.
Invited me.
And also a consultant for the, I want to get this right, the American Community Research Institute on AIDS ACRIA Initiative on AIDS, I didn't get it right, is Michelle Lopez. ACRIA is the initials for it. Nice to have you with us, Ms. Lopez.
Thank you for having me. Thank you.
Dr. Torres, let's just start from the beginning. It's hard to imagine because HIV and AIDS is part of the dialogue. We all know at this point what it is. What was it like as it was literally being discovered, I guess, nearly 40 years ago, a little less than 40 years ago?
So, Gary, in 1981, the CDC issued its first report on 5 men who have sex with men with pneumocystis pneumonia, which was an opportunistic infection. And these were patients in Los Angeles, and it was quite rare. And that was the first report in 1981. But as you mentioned, we've come a long way over the years. HIV was a devastating disease. I remember being a medical student and seeing my first patient with HIV in 1981 at Boston City Hospital.
Now, did you know what it was, or was it this mystery that it was like, well, here's a patient, I'm not kind of sure what to do with this person?
It was a mystery. And
wow,
we
that must be a terrible challenge.
It was terrible. It was, it was called the plague, and it was a terrible time. We lost patients very quickly. They became ill very fast. They were young, otherwise healthy persons getting this devastating illness. And in the old days, they succumbed in less than a year to 2 or 3 years.
What was the process that began to rope it in and get us to, I mean, we have a long way to go till we get to today, but that made you and other medical professionals say, well, we think we kind of know what it is. We'll talk about that it was no longer defined as a gay man's disease.
Exactly.
Considering that Michelle Lopez is.
Hello.
Yes. Yes, so there were other reports that came out. New York Times reported that it was in New York, San Francisco. We also saw it in heterosexual individuals and people who had injection drug use. We started seeing cases in patients who had received transfusions. We saw it in hemophiliacs. So we knew that it was an infectious disease. The origin was an infection. So in 1984, the virus was identified. In 1987, AZT was the first drug approved, Retrovir. And then in 1994, the real breakthrough was when we identified viral load, where we can actually detect the amount of virus that a person has and the newest agents that were produced at that time. And that's when everything started to change in 1996.
You know, from a cultural standpoint, and again, going back to the idea that it was a gay man's disease, it was alleged that way, and maybe there was, well, maybe there was prejudice involved. I think that the moment, and I remember actually when it happened, that Magic Johnson announced that he was HIV positive. I think it was 1991. And at that moment, it was like, now, wait a minute. I mean, I suppose he could have relations with men. It's not my business or anybody's business.
Yeah.
But at that point, it didn't seem like the case. That was an eye-opening thing, wasn't it?
Right, right. It was. I think when society began to realize that it was an infectious cause, that there were other modes of transmission, for example, injection drug use, blood transfusions, unprotected sexual relations between men and men, men and women. So, you know, these causes, needle sticks, could transmit the virus. So we knew that it was a pandemic, you know, worldwide disease.
And I guess cut to the chase 20 years, now we're in a much better place.
Yes,
it's not
yes.
perfect. Who is getting the disease? And you mentioned to me before the show that the theme of World AIDS Day this year is Know Your Status. Do we still have people out here who don't know their status?
Yes,
God forbid they are infected?
1 in 7
Boy,
individuals.
Michelle's just
She's
dying
ready.
to talk, and she's next.
Yeah, so 1 in 7 individuals do not know that they're HIV positive. So, you
1
know,
in 7?
1 in 7.
Who are HIV
in the U.S.
positive? In the
Exactly.
US. Okay.
So it's important that know your status, get tested. I'll tell you, in particular to the Bronx, it's very important. The Bronx has had more people tested for HIV than the other boroughs, which is probably a consequence of a number of variables, including people of color, poverty status, and other social determinants.
I'm going to add in a credit to the medical professionals who
Yes.
have done the educational outreach and all the proper outreach, so that you know, you know, people. I think we're smarter than others. We're a little more aware than others. This is out there, so you deal with it as best you can, obviously.
Yeah. But today, you know, of course, it's still not a curable infection, and it's important that people use prevention. You know, we have methods now to help prevent the transmission of virus, i.e. what's called PrEP. It's a combination of one pill that can help prevent. We actually believe that if you're undetected by taking this medicine, then you cannot transmit the virus. So it's really made great strides in helping lower the rates of HIV infection.
I think it's a perfect segue then to Ms. Lopez. Thank you for joining us. You, frankly, seem enthusiastic about spreading the word, spreading information about it. Talk to me about your roots. When did you find out you were HIV positive? Do you know when or how you were infected?
I got diagnosed. Yes, I got diagnosed in May of 1991. My daughter was born, June of 1990. What started happening, you know, it's a twofold on, you know, how did I get here, right? 1991, I was living in a severe domestic violence relationship where this was impacting my life. I'm free today, so guess what?
Well, I'm sorry for that. I'm happy for this.
That I'm here, exactly. I left my household after being severely beaten that particular night in May. Wrapped my baby, she was 9 months old as a newborn baby. Wrapped her in a blanket and just started riding the trains.
My goodness.
Just praying, God help me. I'm a very spiritual person, very, very spiritual. And, you know, I was switching trains, finally ended up on a train that landed me in Brooklyn. I was a Bronx resident at that time. I actually, and a Bronx resident living in a shelter because I had to be placed in a shelter the night. After I got off the train, I called the ad. It was a local federally qualified health center that was providing care.
Did you suspect that you were
I
HIV?
had no idea. I had no symptoms.
And why did
I didn't
you
think
call?
I had symptoms because the ad on this train that I was riding with my baby that night, the ad spoke to me. The words were, if you're a woman enduring substance use, domestic violence, you're an immigrant woman, you know, if you're homeless.
You were checking off the
and I was just
checkboxes,
going down the line. I said, wow, this ad is speaking to me. I got off the train. and I called the number, and this is how I connect in my spirituality. When I called
That
the number,
saved your life, that
it
ad.
saved my
That
life.
Subway-
It saved my life. That ad. Yes, it did.
Wow.
And
What a
I
story.
continue to, in whichever way that I can, because I ended up working at this organization that tested me, got me into care, placed me in a shelter that night. That organization is Community Healthcare Network. They tested both myself and my baby because of the information. This is 1991 that I shared with them, the things that went on in my life, the abuse, the substance use, So I was asked, would you mind if we test you today, you and your baby, because women and children are being diagnosed with HIV today, and the things that you're sharing with us, you might be someone that has the virus.
Wow.
I said, what do I have to lose?
So
I was tested.
One of the things that was out there, just going back to Magic Johnson,
Mm-hmm.
I only bring him up because he was certainly at the time the most visible person who
came forward.
came out and came
Yes.
forward and was infected. It came out that, well, Magic's going to do okay because he can afford it. Obviously, his resources are.
There
he
was
has
even a perception that he was cured at one point in time.
Right, but he had
Nothing like
access, it's no secret, to very good health care, and he had the funds to do whatever he wanted. Was it more difficult for you to get treated and get the medications and get to where you are now than it would be for somebody like Magic Johnson?
Absolutely not.
Ah.
In 1991, I was an undocumented immigrant, I would say. In the state of New York, we have laws and policies that really impacts the lives, and it makes a difference in the lives of people diagnosed and living with HIV and AIDS. I got health insurance. After my diagnosis, I was immediately placed into care. I got health insurance. I had access to medications. My newborn baby, who was also, because she had a confirmation that she was not going to seroconvert. Not all babies that are born to women who are positive keeps the virus. They can seroconvert. My daughter, unfortunately, did not. She maintained the virus, and we got into care.
And so, cutting right to
Let's
where
cut
we are
through-
now,
yes, to
cutting
where
to
we
the
are
chase
now.
you seem happy and healthy and able to function and have a
I'm
normal
thriving.
life. Thriving.
I'm thriving.
Maybe a better word.
Yes, that's the better word. I'm thriving for the last 28 years. I'm a proud grandmother to that wonderful 28-year-old who was born HIV positive, and her son, he's negative. We have come thus far. There are individuals today who are still asking me, how could you allow your daughter to have a baby? First of all, it's her reproductive right. Secondly, she's well engaged in care. She's 100% adherent.
I'm going to bring the doctor in and put
Yeah.
your story in context, but before we do, how difficult is the care and how closely do you have to monitor medications, other things? Just give me what you have to do to have
It's a
survived
large,
28 years.
it's what I would call a very comprehensive protocol, or what I would say in common words, it's a very comprehensive menu to be alive and thriving with HIV.
And so what do you do to
good
to
medical
maintain?
care? I am in good
You go
medical
every
care.
month to the
I
doctor?
No, it's
No?
not monthly. Because of how well I'm doing now, I can go every 6 months, but I go every 3 months because I do have other diagnoses. I have other comorbidities
Right.
that I'm diagnosed with, and they're not under control.
You take medications?
Yes, I am. I'm on
Every day?
medication, one pill once a day, absolutely, and I take my medications faithfully.
I think you would have to.
Yes.
In a way.
But not
terms of-
everyone. I don't want to give that perception. that
Everybody's different.
Everyone is different, and it's
All
not
right.
everyone can handle a
All right.
diagnosis of HIV.
Which brings
today.
us
So,
to Dr. Torres for some
Absolutely.
context. How common is this story, and for people who need to know their status, what should they take from that that's useful?
So, Michelle definitely is an exceptional patient, and she's done very, very well. And that's
Passionate
why,
about it. That's
exactly,
number one.
very highly, engaged in her care, concerned with her child. She's done an amazing job. She really is really an honorable patient who's done very, very well. But it shows you that today a patient can be adherent, what we call adherent to their medication, which for most patients would be 1 pill a day, which would be a combination of several drugs. Mind you, before 1995, it was a cocktail. It was multiple pills. At one time in the late 90s, it was up to 19 to 20 pills per day.
And how do you
and many
even
side
keep
effects.
track? And
It was
yes,
impossible.
oh my
So
goodness.
the adherence rate was very low. Now the adherence rates have gone up with the fact that we have a single tablet regimen. Again, she mentioned comorbidities. Many patients at risk for HIV do have mental health or behavioral health conditions. They have substance abuse, which with relapse, so that makes it more difficult for them to adhere to office visits and to medication. So we still have a good, maybe around 40% of patients that are not undetectable and are not taking their medicine regularly. So we still have a lot to do.
In terms of just going back to know your status, who needs to check? I mean, does everybody in the Bronx, should they check? I mean, who's at risk? You
I'm
wanna
going to
respond
jump in
that?
and say this. Anyone that is sexually active or have had a sexual past needs to know their status today. There is, there's some individuals put, an age limit, right? I go out as a community educator. I'm meeting individuals in their 60s and their 70s and their 80s who are coming down diagnosed with HIV because sex is a major factor, right? And now,
I guess
as the
we say
doctor,
unprotected sex.
unprotected
I
sex.
can tell you about a patient I
Yeah,
saw
of course.
a couple of years ago. It was a woman, 64, 65, Hispanic, and I saw her because she was newly diagnosed HIV positive. When I looked at her record, she had multiple medical problems, diabetes, high blood pressure, you name it, she had it. But she also developed rheumatoid arthritis, and she was sent by her primary care doctor to see a rheumatologist to see if she could enter a clinical trial. The clinical trial required an HIV test. The HIV test was positive. She was sent to me. First time I saw her, I asked her some simple questions. And she had been divorced. 2 years prior to her diagnosis, she was living with a person that does not live with her anymore, and she didn't recall his name. And that's when I believe she was infected. So the CDC recommends that everyone between the age of 18 to 64 should get
13.
an HIV, right, 13 to 64, should get an HIV test.
13 to 64.
Yeah.
Yes.
Should get an
13.
HIV test at least once in their
Something a
lifetime.
little bit scary about that. But okay.
However, if a person has any risk factors, as she mentioned, sexual history or injection drug use, substance abuse, men who have sex with men, people who have contact, promiscuity. So there are a lot of risk factors. Needle sticks, sharing needles.
Again, I'll compliment the medical community and the medical industry, because you look at this deadly disease and how we have developed it to this point, and look what the potential is. So really, when you think about how incredible medical advancement is, that it's wonderful. But I have to ask, are people, and I'm always concerned in the Bronx, are people in the Bronx still dying of AIDS at this point?
They are. We estimate that there are about 30,000 people living with HIV in the Bronx right now.
Who don't know?
No, who are living with HIV.
Okay.
They are living with it. They have been diagnosed and they're living with the virus.
So who is it that has an unfortunate result in general? Is it somebody who hasn't been cared for, or sometimes it just doesn't work?
The patients that don't adhere to their medication have the worst outcomes.
Which would be, of course, logical.
Yeah, and and it's logical because we know if you're undetectable, if you take your medication and your HIV viral load is undetectable, your immune status stays stable and in fact improves over time. That's the goal of treatment today, someone remaining undetectable. And if they are undetectable, then they essentially, if they're stable, they see the doctor twice a year.
One quick question for you. In terms of the test is a simple test.
Right, there's rapid HIV testing, finger stick, and we usually do a confirmatory test, what's called a Western blot HIV test, fourth
And you
generation.
should go to your regular practitioner, or you can go to any clinic or
You can go to
something?
any healthcare provider, licensed healthcare provider in the Bronx, in the state of New York, and get HIV tested. And generally, if diagnosed, you should see a provider who is experienced in HIV care. Just in 2018, there were about 6 new medications to the market.
Wow. And you really want your
complex.
provider to really know what's going on.
Definitely.
I'm going to make an educated guess that Ms. Lopez is the person to respond to this, and I want to talk a little bit about funding and about what is needed and what has happened. I'm guessing with your work with ACRIA. ACRIA, excuse me.
Absolutely. That's okay.
I told you I was going to mess it up from the beginning. But with your work with ACRIA, then you're well aware of the kinds of supports needed and the kinds of supports delivered. Is the notion of HIV out there strong enough so that the various powers that be know that it should be funded?
We need more. I'm starting
I knew you were going to say that.
I'm starting on, we need more because we're at a stage now within, HIV awareness and diagnosis. I mean, we're dealing with a new wave of adults who are aging now.
Well,
with
you mentioned
HIV,
that earlier. That's a startling thought.
It's a new wave of what I would say geriatric care that right now I would say it may just be traumatic to geriatricians who are out there who have not seen the type of complications. I'm 52, and there are complications I'm walking in that, a doctor who is doing geriatric care normally would not have been seeing me because they would say, well, this woman is 52. What is she? Yeah. But because of the impact of what this virus has done to some of our immune system, we are living longer, but when you look at quality of life issues and the other comorbidities that we are diagnosed with, we are seeing the challenge. We also too have this, what I would say, the acknowledgement also too of individuals who were born HIV positive, and they are now into their late 20s, early 30s. Mm-hmm. So you're seeing this, this profile of individuals in the healthcare that is challenging.
I want to ask you about, because I hadn't anticipated this line of questioning about people who are older. Are these, let's say you talked about people in the 60s, 70s, and 80s.
Yes.
Are these people who have been recently infected, or they had been infected in the past and never knew it, and now either they're seeing results or they got tested?
All of the above.
Wow.
Right? So we are aging. Some of us who knew I got diagnosed at 24, right? So when you do the math, here I am. We have individuals also too, because of educational programs that ACRIA hosts. We go out and we provide sexual education for seniors on their sexual health. Everyone today, again, who is engaging in sex needs to understand and know what sexual health is about, right? So we are,
And I have to say, I'm also going to make an educated guess that if there are seniors who are in their 70s or 80s, maybe they didn't get educated like somebody who was younger and grew up with this in their background because they grew up at a time when it didn't even exist.
Yes, I spent a year as an educator going out to NORCs centers, right? The naturally occurring retirement centers. And I targeted NORCs. And these are all individuals who are even over 60. And we were having conversations talking about their sexual health. I got individuals to understand why it was important for their doctor to provide an HIV test for them. Some of these individuals, because I don't do one-shot deals, I have gone back and, do follow-up, and they said, Michelle, I went and I got tested, and I know my status today, and I'm so thankful because I have an opportunity to do something about it. That's the key.
How many, there's no number, I guess, but just in terms of common, people who are out there, how many people are there like, or do you have advocates, health education, not only in HIV and everything, and all the things that affect us, diabetes and asthma and everything else is so vital. Are there sufficient spokespeople like Ms. Lopez?
We have, I would say, we could use more, of course. We have a few organizations that really are doing a lot of work here in New York and on a national level.
Yes.
The Latino Commission on AIDS does a lot of prevention and education. Right. They have a location in Manhattan called the Oasis Center, which is LGBTQ responsive and very supportive. And we're doing a lot of things here in the Bronx, too, to try to improve our care and access to this population because they have the highest risk.
Using Michelle's experience as a guide, maybe we ought to put out more subway ads.
Absolutely.
Yeah, that was a great medium.
Yes.
Apparently, that's
Yeah.
and are there ethnicities who and people, whether it be you mentioned LGBTQ, are there people who are particularly at risk?
So, Gary, African Americans are leading the charge, right? They have the highest incidence and prevalence of HIV now in the country. Thereafter, Hispanics, and then below that, Caucasian whites and Native American Indians and Alaskans. And then MSM, men who have sex with men, have the highest risk, especially teenagers, transgendered. MSMs have very high risk of HIV, for example.
And so that leads us right into World AIDS Day, which is coming up on Saturday.
The 30th anniversary.
The 30th anniversary was established in 1988. There's an event. There's an event on
this Friday.
The night before, Friday night. We have some information about it. We can put it up on the screen. Tell me all about it.
So it's an event to again to heighten awareness, as your program is doing today, to show respect and to commemorate the war on HIV that we've been involved in for the last 40 years or so.
And I'm going to add and celebrate people like Michelle Lopez who are living with it and passionate about it.
She's amazing. She's amazing.
And there are many more people like that. So we've just put the information up about the time and everything else. Michelle, I want to ask one final question to you. Aside from taking medications and all that, is it an educated guess to say that because you've been in this situation, you eat healthier, you take care of yourself better, and so, not to say it was a good thing that happened, but there were benefits to it because it raised your awareness, it raised your daughter's awareness and your grandchild's
and my
awareness,
grandson.
their grandson's awareness that they have to be healthy, otherwise they're going to have a problem. Right? So is that the good news?
Absolutely. I practice what I preach. You know what I'm saying? I walk my talk. You know, I'm a person, I willingly, a lot of times I have friends and family members. Why are you so willing, you know, to share your status? Stigma is something that is devastating a lot of our work that we can be doing, what we should be doing, and I've decided to take a stand against stigma.
And we don't ignore the obvious, and you have the most gorgeous nails we have ever had on this program. You know, hold them up and let's let everybody, because everybody has seen them.
Oh my God.
I don't know, hold them like this.
Nails.
There you go.
These are my
We've
happy
never
nails.
had in 24 years anybody with nails like that on our program. Michelle Lopez, thank you so much.
Thank you so
Dr.
much.
Torres,
Thank
thank
you.
you so much. Folks, if you have further questions or comments on
you.
anything or you heard on tonight's show, or anything going on in the Bronx, email them to us at BronxTalk@BronxNet.org. You can send us a tweet at BronxTalk or post them on our Facebook page. We try to read them on the air during a future edition of our program. Get tested. It's not that difficult to do. Know your status. World AIDS Day is this coming Saturday. We thank our producer, Helen. Our director is Nick. And to the cast of thousands and to you, we'll see you next week. Good night.
Great.